All right, it's always good to be here. Every Wednesday, I'm here to talk about one social issue or another, health, anything exactly, anything that is newsworthy, anything that has made news. We just bring it the other side of it on flip side. And yesterday, September 17, was World Patient Safety Day. I mean, it's held yearly every September 17. It's not an international holiday, it's just an international observance. And it's to call for global solidarity and concerted action by all countries and international partners to improve patient safety. Now, the day brings together patients, families, caregivers, communities, health workers, healthcare leaders, and policymakers to show their commitment to patient safety. Patient safety is a global health priority. And the theme for this year's World Patient Safety Day is focused on improving diagnosis for patient safety. And they're using the slogan, get it right, make it safe. So today, joining me on the show is going to be the immediate past PRO of the Nigerian Medical Association Edo State Chapter, Dr. Emeka Oko. I'm going to bring him to your screen in a short while after we take the message from the World Health Organization. And after that, you meet my guest and we'll get talking. I'm Daisy Leo Asikidi, by the way.
The right diagnosis at the right time is the basis of safe and effective healthcare. By contrast, diagnostic errors can lead to serious harm and even death. Diagnostic errors are responsible for 16% of preventable patient harm. They can include missed, incorrect, delayed, or miscommunicated diagnosis. As a result, millions of people experience avoidable suffering every year, putting a huge burden on health systems and increasing healthcare costs. Reducing this risk takes collaboration between health workers and managers, policymakers and regulators, civil society and the private sector, and importantly, patients and their families. Together, let's get it right and make it safe.
Diagnosis is part of every patient's journey. Reaching a diagnosis takes several steps: patient history and examination, testing, discussion and communication of results, final diagnosis and treatment plan, follow-up and re-evaluation. Diagnoses can be missed, incorrect, delayed, or miscommunicated at any stage. In fact, almost all adults will experience at least one diagnostic error in their lifetime. Errors can
that we're bringing the immediate past Public Relations Officer of the Nigerian Medical Association Edo State Chapter. I'm talking about Dr. Emeka Oko from the Department of Clinical Microbiology from the University of Benin Teaching Hospital. It's good to have you on my show.
Thank you very much.
We've met
Daisy.
several times, but not on television.
Well, it's a privilege for me to be here alongside with you on a discourse on ITV today.
Yeah, it's
I
my pleasure.
appreciate you.
Okay, so we're going to talk about the World's Patient Safety Day. Every patient out there, almost everyone out there has been a patient at some point, or they've had a loved one be a patient. And if we go around to begin to ask, they've had some very bad experiences in hospitals as well, and most of them boils down to diagnosis. So this year's theme is focusing on safe and correct diagnosis for patients. And so we're going to be talking about the significance, first of all, of the World Patient Safety Day, and why improving diagnosis is crucial for patient safety.
Oh, wow. Thank you very much for this question, Daisy Leo Asikidi. World Patient Safety Day is actually an initiative of the World Health Organization, and it was officially endorsed sometime in May 2019 at the 72nd World Health Assembly, where this actually came into limelight following the growing recognition to increase the awareness of patient safety and also to reduce the risk of harm to these patients across in the healthcare settings across the globe. However, this day also emphasized the need for improvement of safe healthcare practices, and also a call for global solidarity and the need to enhance the practices of this safe healthcare delivery and quality, safe healthcare and quality healthcare delivery in our nation and the world at large. The day has been officially short to be marked every 17th of September annually across the globe. And of course, the theme of this year's initiative is actually improving diagnosis and also improving patient safety. There's a slogan, get it right and get it safe. So that is actually the theme for this year. However, this initiative actually started in 2020 when it was tagged. The theme for that year's program was actually following the light of the COVID-19 pandemic, where it was said that health worker safety is a priority to patients' safety. And also in 2021, the theme for that year was actually safe maternal and neonatal care, which actually came as a result of the burning desire to ensure that the risk to maternal mortality and fetal mortality is reduced to barest minimum. And also in 2022, the theme was medication or medicine safety, which is actually from the burning desire to ensure there is reduction in medication errors. And as a result of that, there is need to admonish proper prescriptions from doctors, and also effective distribution and what's it called? Administration of drugs to patients. And also in 2023, the theme for that year was actually engaging patients for patient safety.
Yeah.
It was very necessary because while trying to improve the safety of patients in the healthcare settings, there is need to carry everybody along, including the patient, the family, in order to improve effective healthcare delivery and awareness as regards the management of such patients. And currently, we talk, like you have just asked, the current team, it is very essential to improve diagnosis of patients, because diagnosis is actually the bedrock to potentiate the well-being of any medical conditions. If you miss it, you miss out. So there is need for us to have adequate diagnosis. There is need for us to ensure there is no misdiagnosis, because when you miss the diagnosis, you definitely may be towing the negative part of treatment and we end up endangering the life of the patient. And there's also delayed diagnosis. Sometimes there is need for collaborative effort, like we have in the tertiary institutions, like in UBTH, you see there is need for multidisciplinary approach. There are several doctors from several fields coming together to digress on a particular condition to ensure effective diagnosis for the betterment of the patient and to improve the quality of healthcare delivery across the globe. There is also a necessity to ensure that we don't have misdiagnosis. Misdiagnosis is different from mixed diagnosis in the sense that misdiagnosis, you may be getting a different diagnosis for a wrong condition. And that is why it is very important for patients to ideally visit a confirmed healthcare establishment instead of visiting the quacks around the vicinities before they finally end up coming to the hospital, which will result to possibly delayed diagnosis from this quack around the vicinity, and when they end up coming to the hospital, it is already a bad state. So these are the possibly things that should be taken into cognizance to ensure patient safety in our environment and across the globe. And in summary, it is centered around increasing awareness. I repeat, increasing awareness of this patient safety around the nation, and also ensuring collaborations amongst health systems, healthcare professionals, and patients, and also to employ best practices, best medical practices in order for us to improve quality healthcare delivery in the nation or the globe, the world at large.
Okay, I want to quickly share a short story of something that happened to a friend's sister. And stories like this are not new to us. We hear them every now and again. She was pregnant with twins, and she was almost due. At least she was about 8 months pregnant. So they discovered she had a problem with her blood pressure, and she was registered in a private clinic, and she was going there for treatment. So I don't know, the day she went for her checkup, her antenatal checkup, they told her her BP was too high, and she was just feeling uncertain. Like, why does it not ever come down? She wanted a second opinion. And so she approached a bigger private firm. I don't want to call names now, but a very popular one that many pregnant women go to. In fact, I was born in that hospital too. And then she got there and they told her, her case is critical. She can't go home. So they had to admit. Middle of the night, they told her she was going to be operated on if her babies will come out safe. And she called her family. This is what the doctor just said. That was not where she registered, but they were willing to manage the case. And then she had the operation and was taken to the ward. The families wanted to stay back. I mean, she just had twins. It was an operation. She's not been very strong. let's stay overnight. But this hospital refused. That family members do not sleep over in the ward. You have to stay outside at the reception. And she started struggling for breath. They both got oxygen. She had it fixed. But middle of the night, at some point, the oxygen left her nose. And nobody was there to attend to her. There's supposed to be a nurse or nurses in the ward, but I don't know what happened. But this is the story I was told, and nobody attended to her. By morning, she had kicked the buckets. So the family ran in that morning, like, okay, it's morning time, let's take tea, let's take this to her. And she can't eat food, solid food yet. But they got there and they found that the bed, she's been ruled out. What happened? The doctor who treated her said she was already badly managed where she came from. And then the cause of death that was written on the paper was mismanaged malaria. And they raised an alarm. They wanted to sue and fight, but eventually, because they were also hurting, they needed to bury their dead, they needed to take care of the twins. It was just a whole lot for them. And that woman actually passed without seeing her children. The issue that took them to the hospital was high blood pressure. The case the doctors are writing on the charts is mismanaged malaria. I don't know what's happened. I'm not a doctor. I don't know any of these things and how it works, but we hear the stories often. So I want to, this leading me to ask, how often do we have diagnosis errors in the healthcare profession in Nigeria? I know it's your field, and please do not protect them, but how often do you think, how common are these diagnosis errors, and what are the consequences most times?
Oh, well, it's the story you just told is actually a sad one, but again, you know that there are different sides of a story. We were actually not there, you were just told. And I can't possibly be speaking for the doctor. But like you said, it was a case of hypertension in pregnancies. There are several complications that it could lead to and can result to death. So we can't possibly tell if that patient eventually lapsed into a clamtic condition and possibly worsen conditions and eventually end up as a case of a misfit for the patient. But however, we can't also tell if the patient was effectively managed because we didn't get to hear the other side of the story. Like you just said it was written on the case note that it was a mismanaged malaria. I find it difficult for a doctor to have received a case of hypertension in pregnancies and end up writing mismanaged diagnosis. So, like I earlier said, there are different sides of a story. I wish I heard directly from the doctor so I could pass a judgment as appropriate. But I want to believe that possibly the doctor may have actually played his role in the management of the patient, as we try our best to ensure that the safety of patient is paramount, and we put everything we need to put and remain diligent to ensure this. And in terms of misdiagnosis in medical practices, yes, there are some conditions. In fact, studies have proven that it is up to about 10 to 15% cases of misdiagnosis or improper diagnosis. And these could range from poor history taking. It could either be from the healthcare provider, which we can't tell who possibly was seeing the patient as at then. It could be from a peripheral center not being manned by a doctor, or possibly paucity of history from the patient. It could also contribute to delayed diagnosis and possibly missed or misdiagnosis, as the case may be. There is also a situation of over-diagnosing certain conditions which possibly are common in the peripheral centers, including being manned by non-doctors or quacks, as the case may be. A situation where peradventure the health caregiver at that point in time, presumed health caregiver, happens to be working with a particular doctor who was managing a specific condition with certain symptoms and signs, and eventually see this patient, another patient presenting now to him without the presence of this professional health care giver, and now feel the same condition as presented by the symptoms the patient before him or her is presented with could also be the same diagnosis as what the trainer or the person he or she initially worked with brought into limelight as results as regards the management of the patient, and you end up either over-diagnosing this patient or under-diagnosing this patient and managing wrongly, and as at the time the patient now presents to the appropriate establishment or health care facility, it may become too late because the head is already off. So I would use this medium to admonish our patients out there to ensure that early presentation to the healthcare facility, when I mean healthcare facility, that is manned by healthcare professionals, not non-doctors. Because to be frank, it is actually the same thing. You know that that person you are presenting to in the peripheral centers, possibly you may even know better because you have that ability to even check things online. You have that ability because you are well educated. Even that particular healthcare giver in the peripheral centers, especially that of the quack, do not possess even a premises certificate, but possibly they just delve into this profession for the sake of making money. You know, this era is quite in a state of a pitiable condition that people indulge in all means to make money without taking into cognizance the life of humanity. So misdiagnosis or diagnostic error, it's actually on ground, but to the barest minimum when the appropriate healthcare facility with the appropriate healthcare personnel is reached as at when due. So early presentation is key. You get it. And also, the patient has a right to understand what the problem is. Because when you are talking to an appropriate healthcare giver, you will get feedback from this person. It is only when you are talking to someone who does not even know what is, just doing things based on trial and error, that is the only situations you won't get fully educated and get carried along as regards the current situation of your condition or the diagnosis in which you are being managed. Thank you.
All right. I think we'll just quickly go on a break. That break is going to lead us till 2, where we'll have the news update. And after that break, we'll come back to the concluding part of the show because our time is almost up. So we'll go on a quick break. We still have a message. We have lots of egg practitioners all over the world committing to patient safety. And we'll just push play to that one for this day, and we'll be back in a moment.
No one should be harmed in healthcare. Yet, every minute, 5 patients die because of unsafe care. These deaths can be prevented. Simple commitments can ensure safe care.
I commit to updating my knowledge and skills regularly to provide safe care for my patients.
I commit to being actively involved in my own care.
I commit to giving the right medication to the right patient, in the right dose and through the right route, at the right time.
We commit to working together as one team, open and transparent, I commit to explaining to my patients how to use their medication correctly.
I commit to using the required procedures for each delivery I perform.
I commit to establishing a culture of patient safety.
Together, we can save lives. Let's commit to ensuring safety in healthcare. Speak up.
Okay, so the program you're watching is Flip Side, the other side of the news. And it made news on September 17 that it is World Patient Safety Day. And so we decided that we needed to talk in depth about that day, about the theme, about diagnosis improvement, diagnosis for patients' well-being and patient safety. And as a result, we had to invite the immediate past PRO of the Edo NMA. I'm talking of Dr. Emeka Oko. He is from the Department of Clinical Microbiology from UBTH to come to the studio today to talk to both the healthcare practitioners, the patients, policy makers, and everyone who's actually involved, families, friends, in making sure that patients are safe. You are a patient at some point, a loved one is a patient at another point. So you really do need this information. And so far we've talked about errors in diagnoses and what could lead to such errors. And we see that it could also come from the practitioners, it could come from quacks, and it could come from the patient. But what can we do to improve the diagnostic process in Nigeria, in the healthcare setting? That's where we're going to at the moment. What advice, what suggestions as an healthcare practitioner are you going to suggest to improve the diagnosis process in Nigeria?
Well, thank you very much, Mrs. Leo Daisy Asikidi. The question is beautiful in the sense that I actually talked about dictated history prior now. It is essential for the healthcare giver to get a dictated history from a patient. And it's also very important and sacrosanct for the patient to unleash the appropriate information to the healthcare giver, because it is key and very sacrosanct in managing conditions that are debilitating to these persons. So false information will actually lead to false diagnosis, and the management of such patient will be skewed. So, and also getting formidable and detailed history from these patients, it is also essential for the healthcare giver to carry out adequate and proper examinations of both the systems and every other necessary examinations that should be carried out for the patient to help to potentiate a clearer path in terms of making a diagnosis for this patient. Also very key is investigations, medical investigations. We could either be blood investigations, radiological investigations, and otherwise. It is essential for the appropriate investigations, so to say, to be carried out, which will further streamline several differential diagnoses on grant, leading to the particular or specific diagnosis as the case may be. It will end up to potentiate quality healthcare delivery and effective management of our patients and beloved ones out there.
Interesting. All right, now, are there programs I'm just curious, for healthcare practitioners, the doctors, the nurses, those working in the clinical labs, to get trainings and retrainings, maybe sponsored by the government? You know, I know some of these your courses can be very expensive, that are available. If you're not aware of any, are there some you would suggest to be brought? Are there equipments that should be introduced at this time of life? Because I'm just saying this because of a baby. A woman lost her baby a few days after she had him. She had a series of scans when she was pregnant, It's a first child, so you know this excitement, every small thing, you don't go scan and all that. But it was never picked up that the baby had a deformed heart. They will listen to the heartbeat and they'll say the baby's fine. And somehow she bettered that child without any inkling that something is going to be wrong. And it didn't take a few hours from that, baby had already passed on, because then they found out through autopsy that the heart was deformed. Why couldn't that scan? And there are more advanced scans that could be introduced as maybe scan machines to pick up things like that. So in essence, what I'm asking is, are there trainings for doctors in Nigeria, for healthcare practitioners in Nigeria to get better informed about diagnosis? And if they aren't, are there trainings you would suggest?
Well, thank you very much. Right from before I came into the practice as a medical student and today a doctor, a physician, there have always been continuous medical educations for doctors and other health caregivers. And they have always been followed up by doctors. Even we tend to attend these continuous educations and trainings and even get CME points to actually update ourselves and upgrade our license, because we are licensed healthcare practitioners. So as regards the story you just perpetrated before us, I want to believe that the proper radiological investigation was not done, because as regards the heart, I want to believe that if it was a professional physician that actually managed the case, possibly a pediatric cardiologist, that diagnosis may not have been missed or mixed, because we have very viable and sound radiological systems to be able to pick such conditions like the echocardiography. The patient may have been subjected to ECG, the electrocardiography, and as a result of that, these diagnoses are considering detailed and effective history taken from the patient and other ancillary investigations, I'm sure it wouldn't have been missed. And to cut this discourse short, I want to reiterate that in as much as doctors are poorly remunerated, because the cost of participating in this continuous medical education is usually huge in terms of monetary engagement. But however, doctors still try their possible best, and possibly other healthcare providers, to make some sacrifices to ensure they engage themselves with more so traveling and receiving these trainings. But it is just that we don't get these remunerations as appropriate from the doctors. We are not even talking about basic take-home. Well, we still want to stand by the grounds that our patient is our priority, in as much as we may like to be properly remunerated, but
we're not surprised. He's almost becoming a politician now. He was a former PR. What do you expect? Okay, I'll ask this one quickly. It's a personal question from me before we have your final words to our viewers on today's discuss. I want to ask this question. My brother is also a doctor, a friend of yours too, and he says something that doctors are like pastors. When you go to them, even with your health issues, they will make you feel better. Even without drugs, they're supposed to be like counselors to calm you down. But a lot of patients recently are complaining that they don't have adequate time to even consult with their doctors. The number of doctors in the clinics seem to be reducing every day because of Japa. So could it also be a problem when it comes to patient management with this brain drain in the medical sector? one, vis-a-vis, what kind of questions should patients be asking? If they are not satisfied with the answers the doctors are giving, what should they do?
Oh, well, like we all know, the pasture is greener out there. So you see this jackpot syndrome is becoming a very prominent, it's causing a very prominent vacuum in X sector in our nation. And in fact, a menace to the nation. I want to still believe as a patriotic Nigeria that someday we will get things right and we'll have the required a number of doctors that is to manage a particular patient in our nation, and all will be well. And as regards the questions the patient should ask the healthcare provider when not really satisfied with healthcare giving, I want to believe that if the patient is really not satisfied, there are certain patients questions, most especially, it's not out of place for the patient to request from the managing physician, if possibly there is need, to understand the problem, the diagnostic condition of his or her ailment, and if necessary, the appropriate specialty to managing such conditions. If it is a private hospital, a recognized, registered private hospital manned by the appropriate physician, it's either the need for a referral or the need to invite a specialist in that field to come, address such condition. And like I said, ab initio, multidisciplinary approach is also key and sacrosanct to improving healthcare delivery and patient safety.
All right. So what message would you like to pass to our viewers on this World Patient Safety Day 2024? That's regarding improving diagnoses, or just in general as a doctor to viewers that are patients or intending patients?
Well, I have initially summarized this, and I think I have to go over it again as regards what World Patient Safety Day. The aim is literally to increase awareness of patient safety, which is supposed to be done by the healthcare givers at large, and to ensure the reduction in the risk of harm to these patients, and to improve also collaborative efforts by multidisciplinary approach by healthcare givers in several specialties will further improve patient safety in the healthcare. And one basic aim of this World Patient Safety Day, the initiative actually came into limelight based on the need to also ensure collaborations amongst healthcare systems, healthcare professionals, and the patient, and also to improve best practices in order to afford the individual and effective healthcare delivery.
All right, so all hands must be on deck on this very auspicious observance to ensure that we're fine. Our doctors are trying; they're doing a whole lot for very little, not financial wise now. The environment, the equipment, there's always need for more. I said something to a friend earlier that our health sector, where they are compared to other parts of the world, you pity them that they have to manage with so many equipment. By the time the equipment the rest of the world are using are getting down to us, they'd already passed that part. They are already gone to something, they've gone to something even higher. It's almost the way energy sector is in Nigeria. We're all talking about how to leave PMS to CNG. The rest of the world has moved past CNG. They are already talking electric cars. They're already talking
19
cars.
energy.
Exactly. We are still here talking about how to get CNG to cars.
We don't
But
use natural. We trek everywhere.
we trek everywhere. So it's just a whole lot. And I must appreciate all the healthcare professionals in Nigeria. To even study anything related to health is a lot of work. But at the same time, we urge you to improve. You've chosen this field. You owe us good services. You have to do the best to keep us safe as your patient. I would not want to carry someone who's seen healthy to the hospital, then you're telling me the person can't come back, and you're not giving me cogent reasons that are making sense to me. You have to help your patients make sense of your explanations. Let it be clear. Break it down to layman terms. Don't give us high-sounding jargons, medical jargons that we cannot process, and it doesn't just work like that. Well, I wish everyone a good day, and we'll be leaving you with our last message from the World Health Organization as we take our leave from the studio.
Healthcare is a complex between science and compassion. At its heart lies a fundamental promise to alleviate suffering and improve lives. Yet, the journey towards healing can sometimes take detours, leading to unintended harm. Recognizing the critical need to prioritize patient well-being, we observe World Patient Safety Day every year. World Patient Safety Day stands as a global beacon, illuminating the crucial conversation about patient safety. It serves as a solemn reminder of the importance of vigilance, transparency, and continuous improvement in healthcare. This day is not merely a date on the calendar. It's a call to action for healthcare professionals, policymakers, and the public alike. World Patient Safety Day reminds us that every patient deserves safe and effective care every single time. It underscores the importance of fostering a culture of safety within healthcare systems, where errors are not met with blame, but with opportunities for learning and growth. Through global collaboration and a shared commitment to excellence, we can create a world where healthcare is synonymous with safety, trust, and optimal patient outcomes. Let us delve deeper into the significance of this day and explore how we can all contribute to building a safer, more reliable healthcare system for everyone. In 2019, the 72nd World Health Assembly took a monumental step by adopting Resolution WADA 72.6 on global patient safety. This landmark decision acknowledged the urgent need to address patient safety as a global health priority. It paved the way for the official establishment of World Patient Safety Day, observed annually on September 17th. Each year, World Patient Safety Day focuses on a specific theme to raise awareness and galvanize action around a particular patient safety concern. This year, the theme is Improving Diagnosis for Safer Care. Accurate and timely diagnosis forms the bedrock of effective healthcare. It guides treatment decisions, shapes patient outcomes, and influences overall healthcare costs. When diagnoses are delayed, missed, or incorrect, the consequences can be devastating for patients and their families. By shining a spotlight on diagnostic safety, World Patient Safety Day 2024 aims to mobilize stakeholders at all levels to address the challenges and improve diagnostic accuracy. This includes fostering collaboration, promoting best practices, and advocating for policies that prioritize patient safety in the diagnostic process. Diagnostic errors, unfortunately, are more common than we might realize. They can manifest in various forms, from delayed diagnoses to misdiagnoses and incorrect diagnoses. These errors can occur at any stage of the diagnostic process, from the initial patient encounter to the interpretation of test results. The impact of diagnostic errors on patient safety is profound. A missed or delayed diagnosis can lead to the progression of an illness, potentially to a more serious or even life-threatening stage. An incorrect diagnosis can result in unnecessary treatments, some of which may have harmful side effects. Beyond the physical impact, diagnostic errors can also have significant psychological and financial ramifications for patients and their families. They can erode trust in healthcare providers and the healthcare system as a whole. The emotional toll of living with a misdiagnosis or the consequences of a delayed diagnosis can be immeasurable. Improving diagnostic safety requires a multi-pronged approach. It demands a system-wide effort to identify and mitigate potential risks, improve communication and collaboration among healthcare providers, and empower patients to be active participants in their own care. World Patient Safety Day 2024, with its focus on improving diagnosis for safer care, sets ambitious goals to bring about meaningful change in the realm of diagnostic safety. The overarching aim is to reduce diagnostic errors and ensure that patients receive accurate, timely, and safe diagnoses. One of the key goals is to raise global awareness about the importance of diagnostic safety. This involves educating healthcare providers, patients, and the public about the prevalence and consequences of diagnostic errors, as well as the factors that can contribute to them. Another crucial goal is to foster a culture of safety and continuous learning in healthcare settings. This includes promoting open communication about diagnostic errors, encouraging healthcare providers to report errors without fear of retribution, and using errors as opportunities to learn and improve systems. World Patient Safety Day 2024 also aims to advocate for policy changes that prioritize and support diagnostic safety. This could involve investing in research and innovation to develop better diagnostic tools and technologies, as well as implementing policies that promote transparency and accountability in healthcare.